To another episode of the Rotator Cuff Expert. I'm Dr. Daniel Orcutt, board certified orthopedic surgeon. Today we're going to talk about a topic that's very common, that's a little bit misunderstood: shoulder bursitis. Bursitis is a very common complaint, and sometimes it may even be a little bit misdiagnosed or overdiagnosed. Pretty much anybody who has shoulder pain anywhere around here, most likely someone's going to say, hey, you must have bursitis. Or you might see your primary care doctor and they say, hey, you must have bursitis. And it may be bursitis because bursitis is very common, and maybe something more than bursitis. So that's the key to know. We'll talk about bursitis, what it is and what we can do about it and why it happens. But it's also super important to understand what it is and what it might not be, or maybe it's not, and make sure you go see a regular doctor and perhaps your orthopedic surgeon for them to evaluate to make sure it is in fact bursitis and not something more. Something more could be a rotator cuff tear or other pathology, other problems inside the shoulder joint, arthritis, could be your neck, it could be lots of other things. So we'll talk about bursitis specifically today. Again, but I would caution you that just because it's common, it doesn't necessarily mean that's what you have. So it's really important to see your doctor and try to sort through this. But bursitis is an inflammation of the bursa. Bursa is a little sac of fluid. So we have bursas all over the body. Bursas, superficial bursas and deep bursas. The shoulder has multiple bursas and most of them are deep. So the bursa looks like a little sac of fluid. And in the shoulder, we have the ball underneath it with the rotator cuff coming across and attaching to the outside. And then we have a bone up on top. We'll show you a picture, and this picture is actually from Netter's Anatomy, so it's a book that is very common that orthopedists and other anatomy people look to and reference. So the pictures are from Netter's Anatomy. I think it's the 6th edition. We'll make sure of that. We'll put it in the show notes underneath. But anyway, this is obviously a cartoon, but the picture will show you a little bit better. So if we have this bone, and we have this bursa, and we have this rotator cuff, and then we have the ball, and then we have the socket joint. So when we have bursitis, this is the bursa, this is the itis. The bursa actually also continues down. So if we want to get technical, this is the subacromial bursitis. So subacromial, this is called the acromion. So subacromial, below the acromion, is the bursa, all right? And then this is called the subdeltoid bursa. So if we look at the acromion, there's the big deltoid muscle, which is the big shoulder mover, is there. And so it's below the deltoid, the subdeltoid, and they often, almost always, are connected. So if we have some irritation here, we get some fluid made, and that fluid runs down here. And that's why people, when they talk about shoulder pain, often talk about shoulder pain here, not necessarily here. The shoulder pain here is because the irritated fluid from the bursa runs down and irritates the bursa down here too. So what is the bursa and what's the purpose of the bursa? Well, the purpose of the bursa, this is bone and this is tendon. So we need a little spacer in there in between them so it slides easy. So when we do this a lot, we have the easy sliding of the muscle tendon up below the bone. So this is what a deep bursa is. So again, there's other bursas that are more superficial bursas, but specifically this bursa, sac of fluid, gets inflamed. That's the itis part, right? So if we have subacromial bursitis, we have more fluid in this bursa, and that fluid is inflamed. So it's irritated. So it's a different makeup of fluid as well. It's not just more, but actually has different irritants in that inflamed fluid that causes the pain. So that's what bursitis is. And so why do we get bursitis? Well, there's lots of reasons why we get bursitis. Probably the most common reason to get bursitis is overuse, doing this over and over and over. So you can do it when you're young, in your 20s, you can do it when you're older, when you're 50s, 60s, 70s, you can irritate it. It's a lot easier to irritate as we get older. And some of the reasons is you have your problem with the rotator cuff underneath. So the rotator cuff's not working well. We may have an up and down of the ball and socket as you move it, and that up and down can pinch that bursa and irritate that bursa. So that's one way to get bursitis. Sometimes people can have rotator cuff irritations from other reasons or partial tears of the rotator cuff that can cause bursitis. Traditionally, it's more about an overuse when we talk about if it's purely, truly just bursitis, it's an overuse problem. And so we have to try to figure out how to decrease that overuse. So that's common, right? Okay, so what do we do if we have bursitis? So this is truly bursitis. Well, the most common things are the things that everybody does when they get injured. One is they rest, they ice, and they take anti-inflammatories if they can. Anti-inflammatories, this is itis, we get rid of the itis, the anti-inflammatories. So the key thing for us is not heat. one, heat up here probably is not going to get to where we need it to get to. And if it does, it's going to increase the wrong kind of blood flow. It's going to dilate those blood vessels, and actually more fluid is going to come in, more inflammatory fluid is going to come in, and that's going to irritate it more. So we're going to try to stay away from heat. We're going to try to use ice, although it may not feel as good. And then if the rest and the ice and the anti-inflammatories are not helping, then the next step, and maybe even before this, but the next logical step is to see an orthopedic surgeon or a primary care doctor for them to look at you and get some x-rays to make sure your bony architecture is okay. And look at you and see how your range of motion is. Make sure you don't have adhesive capsulitis or frozen shoulder, which is obviously different than bursitis. And if it's not, and if it just seems to be just bursitis, then perhaps therapy may help. Physical therapy to work on strengthening those muscles around the shoulder to help decrease the inflammation on bursa. There's other modalities they can do, ultrasound and that kind of stuff to kind of decrease the inflammation in the bursa. And then sometimes we would do an injection, a steroid injection that would go below the acromion, above the rotator cuff in the subacromial space, and that steroid injection, the anti-inflammatories from the steroid injection often can help as well. So I hope this helps. So bursitis, it's very common, but it's not the only thing that can be wrong with your shoulder. So make sure if you're having these problems and they're not going away with easy rest, ice, anti-inflammatories, then go see someone, have them check it out, and make sure so you can make sure that what you have is bursitis and they can help treat you. Again, key thing for you to remember is the bursa sac of fluid underneath the acromion, subacromial bursa, subdeltoid bursa, they connect. That fluid here runs down to here, causes pain here. We'll make sure there's nothing else going on. Make sure there's not arthritis here. Make sure there's not a inflamed tendon or tendonitis, which often there is. Make sure there's not a torn rotator cuff. And then get to the people who know what to do for you and how to help you and get you better. Anyway, thanks very much. Again, the images, this is my image, so this is not Netter's image. So the image you'll see, there's two cartoon, so to speak, images you'll see. Those are both from Netter's anatomy, and we'll get the details exactly where, in what version, and what edition is, so you can look them up yourself if you'd like. Okay, well, I hope this helps, and I hope your shoulder feels better soon. Thanks.